Welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Thank you so much for joining us. Our guests are Dr. Russel Ashinoff and Dr. Lisa Schneider, co-directors at the Center for Lymphedema Surgery at the Institute for Advanced Reconstruction, joining us here today on the program to discuss one of their cases, a young woman that was diagnosed with lymphedema several years after being cancer-free from her melanoma. Welcome to the program, both Dr. Russel Ashinoff and Lisa Schneider. Thank you for joining us today.
Thank you for having us.
Thank you for having us.
Dr. Ashinoff, a bit of background about yourself.
So I'm a board-certified plastic and reconstructive surgeon. I'm also board-certified in general surgery. I've been in practice for 9 years, and our practice consists of general plastic and reconstructive surgery, and additionally, Dr. Schneider and I have taken a special interest in the treatment of lymphedema, and our practice is based in central New Jersey, and we have offices throughout the state in New York and also in Pennsylvania.
Dr. Schneider, are you a plastic surgeon as well?
Yes, I'm also a board-certified plastic and reconstructive surgeon, and I'm in my 4th year of practice. I did a 6-year combined training program in plastic surgery, followed by an additional year of fellowship in something called reconstructive microsurgery.
You two are among the handful of doctors that offer some cutting-edge treatments for lymphedema. Dr. Schneider, what exactly is lymphedema?
So lymphedema involves swelling in the limb, often an arm or a leg. This can happen in patients for no known cause or can happen after lymph nodes were removed for cancer.
There are some patients who can develop this having no cancer treatments. Dr. Ashinoff, what about problems with the lymph nodes that have nothing to do with cancer, that have unknown origin? What are some of the origins, some of the reasons?
Well, there are different types of lymphedema. So if a patient develops lymphedema for no reason whatsoever, we call it primary lymphedema. And the approach to the treatment is a little bit different. If a patient has, as Dr. Schneider said, a cancer or a cancer-related reason to remove the lymph nodes or administer radiation to lymph nodes, that can cause lymphedema, which we call secondary lymphedema. And then there are other categories of patients. So, for example, we have a number of patients in our practice who have had a single lymph node removed because the doctor needed to get a diagnosis. They were worried that it was cancer. And the lymph node was removed, and it turned out to be benign, and then they developed lymphedema in that limb. So those patients kind of fit into one of the in-between categories, and they're among the patients who do the best with this treatment.
Are there some early warning signs that this condition is about to present, or is this something that's a given if you undergo certain types of treatments for cancer?
It really depends on the patient, but certainly anytime you've had, as Dr. Ashinoff was saying, either lymph nodes removed or lymph nodes examined, even if they turned out to not have cancer in them, or radiation to the areas that you have lymph nodes, typically in your armpit area or in your groin, and after that develop swelling in either your arm or your leg, that would be somebody who we would consider might have lymphedema.
Now, one outstanding case, a young woman that was diagnosed with lymphedema after being cancer-free. Talk about this woman, please, and this case.
So, Anna had a melanoma that was detected. She's a young woman in college. She had a melanoma, and as part of the treatment for the melanoma, the lymph nodes near the melanoma in the groin were sampled. Sometime after that treatment, she developed swelling in the leg that was fairly noticeable, and lymphedema can be very mild or it can be very advanced, and we think that the earlier you intervene, you can prevent its progression. So in Anna, we started seeing her relatively early in the process where the swelling was subtle but detectable. So there are a couple of important aspects to the treatment. So conservative therapy, which has been done for many years, is important both before and after, and that consists of manual decompressive massage and wrapping to keep the swelling down. And then certain technologies have become available recently to make the surgical approach more reliable. So in Anna, we ended up performing a lymphedema surgery on her, and she had great results and is very happy. And we don't like to use the word cure because you don't know. We do our best for every patient, but you don't want to overpromise and underdeliver. We'd rather do it the other way around. So Anna's had a great result, and she's very happy.
Dr. Schneider, what exactly was done in the lymphedema surgery?
We actually used two different techniques and combined them in Anna. So one thing that we did is something which sounds like a mouthful called a lymphaticovenous anastomosis, or more simply by its initials, LVA. Yeah, LVA is a little bit easier. It's a connection between the lymphatic vessels, which are blood vessels just like the artery and veins, and a vein. So it's almost like a bypass on the highway to give the lymphatic fluid or lymph fluid an alternate pathway to go up the limb. The other procedure that we did that we combined with that one is called a lymph node transfer. And we actually took a small area of lymph nodes from Anna's lower abdomen, about the size of a plum, and moved those into an area where she had lymph nodes taken from the upper part of her leg. And we combined both of those procedures together to get her results.
Now, obviously, those procedures require some, level of health and endurance of the ability to withstand on the part of the patient. Do either one of those lend themselves more readily to the older patient who's dealing with lymphedema or the younger patient?
Well, I would tell you that the physiologic age is more important. So if you have a 75-year-old who runs marathons, they often do just as well or better than a younger person who's less healthy. But the surgical procedures themselves are not as physiologically taxing as they sound. They may be a mouthful to pronounce, but they're actually fairly straightforward and very well tolerated, especially when you have two surgeons working together to complete it in a safe and timely fashion. So that's what's unique about our program, is that Dr. Schneider and I are both together at every procedure, working together to ensure a successful result.
Now, we'd like to learn some more about some of these procedures and treatment options for lymphedema. Is there a website where we can learn more about lymphedema and the Center for Lymphedema Surgery at the Institute for Advanced Reconstruction? There
is. Our website is advancedreconstruction.com, and there are numerous subheadings for all of the surgical specialties that are performed within our practice, including the lymphedema subspecialty.
Dr. Russel Ashinoff and Dr. Lisa Schneider, thank you both for talking with us today.
Very good. Thank you for your time.
Thank you. It's our pleasure.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at hpr.fm and healthprofessionalradio.com.au. You can subscribe to the podcast on iTunes, listen in, and download at SoundCloud, and visit our affiliates page at hpr.fm.